Hello and welcome to Medical Shorts by Tutor IMG. In this tutorial, I'm going to tell you how to differentiate between various psychotic disorders. I'm going to start with schizophrenia, which is a complex mental disorder. In order to make the diagnosis of schizophrenia, the duration of the symptom has to be more than 6 months. The patient is going to present with the positive as well as the negative symptoms. The most prominent positive symptoms include auditory hallucinations, delusions, disorganized speech, and behavior. In negative symptoms, the patient have social withdrawal, lack of emotion. The most important thing that will help us to differentiate it from other psychotic disorder is the level of the functioning, which is markedly impaired at occupational as well as social level. Patient cannot go out, they cannot work, they cannot go out, meet with people. So the level of the functioning is markedly impaired. We treat these patients with antipsychotics, which is a drug of the choice for these patients. Along with that, psychotherapy, mainly the cognitive behavior therapy, and social rehabilitation. Coming to schizophreniform disorder. In schizophreniform disorder, the duration of the symptoms are from 1 to 6 months. If the symptom goes beyond 6 months, we give this patient diagnosis of schizophrenia. So for specifically schizophreniform disorder, the duration of the symptom has to be between 1 and 6 months. Patient is going to present with the positive as well as the negative symptoms of schizophrenia. The level of functioning is not required to make the diagnosis. The treatment of the patient is with antipsychotic in combination with psychotherapy. Coming to schizoaffective disorder, the patient is going to present with the symptoms of schizophrenia plus mood disorder, okay? But in order to make the diagnosis of schizoaffective disorder, the symptoms are usually more than 1 month. But do remember, in order to make the diagnosis of schizoaffective disorder, there has to be a time period of 2 weeks in the lifetime of patient where the patient has only symptoms of schizophrenia without mood disorder. That's the most important thing to make the diagnosis. That 2-week time period in which the patient has only symptoms of schizophrenia without mood disorder. The treatment of the patient is basically antipsychotic in combination with either mood stabilizer or it could be antidepressant depending on the kind of mood disorder, plus psychotherapy, okay? And as I have mentioned to you, the level of functioning is not required to make the diagnosis. These patients present with the symptoms which are usually more than 1 month. Brief psychotic disorder, the duration of the symptoms are more than 1 day, but less than 1 month. The brief psychotic disorder can happen after the stress, trauma, in postpartum period. It can happen even without any trigger as well. The patient presents with the positive symptoms of schizophrenia. The good part of brief psychotic disorder is that the patient has written of the premorbid functioning in less than 1 month, okay? So you treat these patients with antipsychotics plus psychotherapy, but few patients, you need to admit them in the hospital because they have the tendency to harm themselves or to others. Okay, so this is how you can differentiate between various psychotic disorder. If you like this video, please subscribe to this channel, and thank you very much.